Williams.
And Lucas Tyndale.
And we are back with another episode of Lucas Live News. Today, it's going to be a little different.
It's pretty special. We have a room full of people. The studio's packed.
They're looking at us.
They're looking at us right now.
We have a
sweating.
live studio audience, actually.
We do have a live studio audience, but they're all going to be guests too, so they better be sweating as well.
Yeah.
Okay, because
Yes,
they're
they
going to
are.
have to be on the hot seat. They're going to have to answer some questions, but I think it's questions that they're ready for and they're going to care about. Whether you're watching live or by replay, you want to stay tuned because today is going to be a very special show. You don't want to go anywhere. Danny, what we got going on
Absolutely.
here today?
We're having real conversations, okay? This episode is called Health Matters. We're talking with local health experts about topics like cancer and cancer prevention, diabetes, mental health, substance abuse, things like that. And we're just going to learn and get educated on some of these health-related topics.
All the things, right? These are all the things
All
that,
of the things.
because health does matter. We know about it. It's so sad because so often, we often face health when we face health crises, right?
Right.
Our family members, our loved ones, we're dealing with something, someone gets a diagnosis, and then we're like, oh no, health matters now.
Yes.
But health matters before we face the crises. Health matters before we face the mental health crisis, before the diabetic diagnosis or whatever it is. Or, you know, but so often those things happen in our families and we face those tragedies, the cancer diagnosis or whatever it is. We want to tell you today that health matters right now. And we want to talk about it, and we want to be preventative about it, and we want to bring the experts to the table today. So that's what we're doing. Thanks to the Strong Family Wellness Foundation. The Strong Family Wellness Weekend is coming up here next weekend, and they brought a bunch of guests to the table. It's thanks to Sean and Shahidra Strong that we have so many people here today.
Yeah, I can't wait for you guys to see them all, hear from them, and learn about some maybe like preventative ways that we can stay ahead of our health, okay? But stay tuned because we're also going to be having our community spotlight coming up, our Scumba and Beyond, looking inside that and talking to Lydia Lee. And we will also have our sports segment on the way as well. So stay tuned for an action-packed, fun show, man. I'm so excited. So before we get started, we are going to hop on over to our community spotlight segment. We are switching mics on live, baby.
We're going to see what happens. We're going to switch mics live.
That's
that
fine.
works. Okay, our production staff is really
They're
good
amazing.
because they make stuff happen live. Whatever happens, we make it work. That's amazing that they were able to make that happen.
Absolutely.
I don't know how they did that, but
I don't know.
That's great.
I thought I sounded good.
I thought I sounded good because I sounded good in my own ears.
Me too.
You know what I mean? We sounded good to the people in the room. It's all
Listen,
good.
if you are at home and you're watching live or by replay, make sure you share this broadcast. Tell your family, tell your friends. We are talking about health. Everything health. We're still having some fun on Lucas Live Media, but it's going to be all about health. So share this, give us a comment, give us some hearts. We'll be right back after this. We're heading into Community Spotlight. All right, so it is that time. It is Easter egg hunt time. I'm so excited. Be a better me. Officer Lamar Sharp is bringing that back again this year. How you feeling about that?
I'm
Last year
feeling
was
great.
so fun.
It
My
was
son got
so
all
fun.
types of
He
stuff.
did. He won all the things again.
He
I don't
did
know
all
how.
the things.
He got all
All
the
the
stuff, right?
things. He
So
did.
shout out to Officer Lamar Sharp and the Be a Better Me Foundation and all that they've continued to do in the community. They're back at Centennial Plaza. They have a kids Easter egg hunt, and then they have something for adults. I don't know what's going down with the adults, but I think you got to take your kids home, and then you got to come back and do some adult stuff. And they're going to do something at Melange. Shout out to the owner of Melange and what they're going to be doing there because it's really for the adults at that point. I don't know.
Yeah.
You're going to collect your fun and your gifts and your prizes. And then have a little after party, but shout out to them this weekend coming up. I mean, there's so much going on this weekend.
Yes,
There's a
there
lot coming
is.
up.
Yeah, so again, the adult Easter egg hunt.
And that's
is
April
coming.
12th.
April
That's the
12th.
same weekend
So
as-
same
we got a
weekend
lot
is
going
so
on.
yeah,
Yeah.
bring the kids out. All right, so the adult Easter egg hunt is coming up again. With that again, Master Experience Weekend. Okay.
Yes.
So this is gonna be.
It is the Master Experience
It's the
Weekend.
Master
Now, let's call it what it
Experience-
is.
Let's call it what it is.
'Cause that's
It's
what
the
it is.
Master Experience
And
Weekend.
they're also doing that.
Yes.
Okay.
Okay.
Let's be clear.
So.
Okay.
Today we have all of the panelists from our Health and Wellness Vendor Fair. They're going to be at the Health and the Wellness Vendor Fair, educating the people, talking to the community, and they're right here in the studio. But also, we're going to be doing the step thing. Y'all remember,
You was in here stepping on the iPad box. I remember
I'm
you.
dressed today, so
You
I
dressed
don't
nice.
act like
you got
that
A,
when
you got
I'm
a special
dressed like
event
this.
today.
Yeah.
You're a distinguished woman today.
Yeah,
You're not
you know,
acting silly
you
in the
know.
studio like you were that day. I don't know what you was doing.
I don't know either.
That was crazy.
No, I know
didn't
what I was doing.
You do.
The All Black Affair is happening.
Yes.
There's a comedy show.
Yes.
There is a pass the mic. I had to ask, like, what is that?
Yeah.
But they said it's when they're stepping and somebody passes the mic
That
and
was
they.
what we just did. We just do a
That's
pass
what
the
we
mic?
just did.
That's what
We did a
doing.
pass
You saw
the
the
mic.
beginning of the show.
We sure
was
did.
practicing for the pass the mic. That's all that was. That's
it.
all that was.
Michael Austin, I got to see him at Rosalind Pratt's
Yes.
show. He did an amazing job.
He's so talented.
he'll be, him and DJ Low
He's a saxophonist.
He's a saxophonist.
Saxophonist.
And he did a great job.
He's a phenomenal
He's a great,
saxophonist.
And then the gospel step. I shared a video from Phil's page. He's the extreme step guy,
Yes,
right?
yes.
And they were stepping and they were singing melodies from heaven. I was like, what? I would have been there. Yeah, it was
a
fun.
worship experience.
Man, what? I would be.
That makes
Imagine the workout you could get to
Because
that.
normally in church you'd be kind of sweating and worshiping. And
No,
you'd be
so
normally
you know.
why not give a step in there?
Why not?
Anyway.
Why not? So
Got
a super fun, packed weekend. This is all next weekend.
April
So
12th.
I don't know about you guys, but get your outfits, get your gym shoes, get your
Yes.
stepping shoes, whatever it is that you
Right.
need, because we are going to have a blast this weekend, and we're also taking care of ourselves. That is why this weekend is happening.
It is so special. And
Yes.
people need to come out because the beautiful part about the vendor and wellness fair is that's absolutely free. It's open to the community. They get to come out and come to all of these different tables and get all these resources and learn more. That's the part that people really need to come take advantage of, because so often people don't know what's going on or don't feel like they have the resources. Times are tough and costs are going up and people don't know what they're going to do and they feel like their jobs are being threatened and different things, whatever may be going on. There are resources in this community and you need to learn to swim before you're drowning.
Yeah.
Right? Don't wait until you're in a bad situation to get the help you need. Don't wait until you're in a bad situation to get the resources you need.
Yes.
April 12th weekend, that morning, 10 to 2, April 12th is the day to come out to the Canton Civic Center to get the resources you need. We're going to be there. We hope to see everybody else out there.
Absolutely, you guys. So before we get in and meet all of our panelists and get to talk to them, you guys need to share this broadcast, give us some hearts, leave us a comment, tell your family, tell your friends. But right now, we're going to head into Mentor Start Moment, and we'll be right back after this. All right. Okay. Okay, so the mics don't work at all?
What's up, everybody? We are here with a wonderful panel of guests. We told you guys we have the city here. We have everybody from the whole city is represented here. But we're going to start with the first lady of the Strong Family Wellness Foundation. Shahidra, welcome to the show.
Thank you. It's good to be back.
Yes,
You know I love being here with you guys.
You're not just a guest. You're like a fellow co-host. You're one of us.
Yeah, you know, this is my microphone.
This is your microphone. Yes. So we're gonna
Shahidra.
treat you like a co-host. So you're gonna help run this thing. So don't be
Let's
sitting
do
here
it.
being shy.
Yeah.
You're gonna help
No.
pitch things around, and you're gonna help run this thing here today. You're gonna help quarterback this thing.
Have you
okay?
known me to ever be shy?
I've never known you to be shy. From
I
the day
just thought
met
I'd
you.
ask,
Okay,
you know?
good.
No, good morning, everybody. We're so excited to be here. I'm so glad that we were able to pull this together to have a comprehensive conversation about health. It's very easy to get hooked on a fad or like, a trend when it comes to working out or even getting healthier, just taking medicine, whatever you need to do. But it's another thing to pause for a minute and actively listen to someone tell you what facts are when it comes to health and what mysteries you've just been buying into. This is an important conversation. And I thought it was important because of what we do with Strong Family Wellness. We don't just want people to come and see an exciting workout and decide like, oh, I want to come to class and I want to be a stepper now. Like, that's great. Yeah. However, this community wellness fair literally started because of the community. Yeah. It just started because of the workout class. Yeah. We just wanted resources on how to make it through a 30-day body reset. So I'm going to tell the truth. It was hard for me on that 30-day body reset. I wasn't the nicest on some days.
It was an attitude reset as well.
It was, a little adjustment there. But I had to find ways to supplement for some of the unhealthy habits that I had always been used to doing. And putting that list together for a small community group of people then turned into us looking towards our community. Like, how can we help everybody, not just the people who want to come all the time? Because some people may never step foot into a step class. They may just want to get healthier. So that's what today's about.
I love that. Now we got to introduce everybody here.
Yeah.
We're going to go down. We're going to start down here. We're going to have everybody introduce themselves and where you're here from and why health matters to you. Let's start here at the end of the table.
Hi, I'm Annie Taylor, and I'm from Altman Health System. Why health matters to me is because we all want to be around. We all want to be around for our families. We all want to be around for our friends. And it's important to focus on that and to take care of ourselves.
I love that.
Yeah. Good morning. My name is Nicole Solinsky. I am with Cleveland Clinic Mercy Hospital. I'm a dietitian and their diabetes education coordinator. And health matters to me for a similar reason there, but also, I've been through my own health journey through my life, my family, my children, and I want them to have somebody to look up to mentor what maybe good health is down the road, because we only get one body and we got to take care of it from beginning to end.
I love that.
Hi, my name is Zachary Wheelan. I'm a pharmacist with Altman, and health matters to me because it just impacts every part of your life, your day-to-day, the people around you. So I think it's really good to advocate for yourself and really take care of yourself.
Hi, Dr. Sabrina Shalad. I'm a breast surgical oncologist with Altman Health System. Health matters to me just as the rest of the panel said. It impacts every part of your life. Getting up every morning, walking around, doing all the things you want to do to be able to spend time with your friends and family.
Absolutely.
Love that. Yeah, Shahidra.
Yes.
Tell us, why does health matter to you? I mean, you talked about you just tried to do a reset and it turned into all of this. But it must matter to you more than that.
Health matters to me now. Mm-hmm. And I can be honest and transparent because, of course, we have a circle of trust here. I mean, why not? Health didn't always matter. I thought as long as I felt good, I was healthy. Mm-hmm. And that's just the truth. I was like, oh, I'm fine. I wake up every day, enough caffeine to kill a bear, but I'm cool. Like, I'm good. Like, I'm okay. And it wasn't until recently that I started thinking about how interconnected all the ways we are healthy really, like how they're all really interconnected. And that's why it matters now. Because it matters for every part of me, not just my mind, not just waking up and being able to tell myself I'm going to be okay, I'm going to make it through, because that's a false push sometimes when you're not healthy and when you don't think about your health. That's a false affirmation when you really aren't taking the steps to be healthier. And I wasn't. And it wasn't until I had a little bit of a health scare that I was like, ooh, girl, we are not going into 40 doing this. Because it's necessary. And it just matters for every part of you. And I see that now.
I love that.
All right, so
Does
do
health
you want to know why health matters to me?
Yeah.
Yes, Danny, tell us.
You're not a specialist in the world of health.
But you know what? I am a vegetarian. I've been a vegetarian for 8 years. I try to live like a more of like a natural, holistic lifestyle. I try. I am not perfect, but I try. So I think health absolutely matters to me. And I look at
more of my intake on foods, and what I'm putting in my body as far as
Yeah.
medications and things like that. I'm not a big, I know I'm sitting on a panel of a bunch of doctors and stuff. I'm not a big medicine taker. But I do like to, other ways to.
Right.
God,
You're getting a new mic.
Oh
You're
my
getting a new
goodness.
mic.
All right.
Right, live.
Getting a new mic. Right, live.
Right. So health matters to you.
But
Am I getting a new mic too? Okay, we're
I
both getting new
think
mics.
one of the reasons why I wanted to make that transition was because my health mattered.
Yeah.
Because I wanted to put healthier things in my body. Because I wanted I wanted to feel better. I was always an athlete, and I think when I started to learn about just the intake of dairy and stuff, I noticed how it was affecting me in certain areas of my life. And I'm like, you know what? So I started cutting things out that I guess I started to learn about, do research on, and I noticed how they affected my health in my body. So health matters to me, especially when it comes to diet. So health matters to you.
Well, I don't know. I may need to borrow your microphone. Okay, health matters to me because we have a whole bunch of people on here talking about why health matters, and so it matters a lot. All right, very good. Okay.
We're gonna jump into cancer prevention. I don't really know.
I think
It's falling. Cancer prevention and behavior change. So we can start with anyone really. But what do you guys think the biggest misconception for cancer prevention is? What's the biggest misconception about that? Miss Sabrina, she can start. She got her juices flowing.
What? It's interesting. So most of my patients have breast cancer. And one of the biggest misconceptions that my patients have is that if they don't have a family history of breast cancer, that they won't get breast cancer.
Okay.
And that's unfortunately just not true. So 1 in 8 women get breast cancer regardless of any family history. And that's probably one of the biggest things that women don't realize, that family history does play an impact, but it's not the only factor. It's a lot of the environmental things, all the things our bodies are exposed to, which can increase a woman's risk of developing breast cancer.
I love that. Can I ask a question?
Of course.
So in my experience, I think I've been learning, I don't know if this is right or wrong, but when it comes to hereditary things, do you think that is like straight from like your mother, your aunt bloodline, or do you think it's habits? Do you think it's the way that mom and dad have always cooked and their habits, and now child does the same things, and now you're dealing with the same kind of health problems?
So only about 5 to 10% of breast cancers are actually related to a genetic reason.
Interesting.
Most of our breast cancers are environmental. So it is all the foods, the things that we're eating, the way that we're exercising. There's some things you can't control, like when women start having periods, but when they have babies, and all those things go into a woman's risk of developing breast cancer. And then the other part of that is it's not just the mom side of the family, because some women will say, oh, well, there's no one on my mom's side of the family, but, grandma on my dad's side or dad's 4 sisters had breast cancer. That they're just like, oh, but that's okay. It's like, no, that's not okay. That's still important.
Thank you. I appreciate that. Yeah.
That is a fascinating statistic because my mother sadly passed away from breast cancer. My mother-in-law had breast cancer, and so I think about my daughter, and so it certainly seems very concerning because you think genetically she is extremely predisposed to it, but you're saying that's not always the
correct
factor.
Yeah, and so whenever there is a family history like that, we always want to look at that as well as the other risk factors. See, is there a gene that works not quite right? Or is it just environmental? Again, it's 1 in 8 women without family history. So it could just be that unfortunately, mom and mother-in-law were those 1 in 8, but there could be something else.
Yeah. Interesting. Fascinating.
Does anybody else want to weigh in on that? Any of the misconceptions about cancer prevention that you kind of wish that more people knew about?
I would maybe add, I think that some people are nervous to come in and get their screening mammogram, thinking that the radiation there is going to cause cancer or give them breast cancer, and that's not the case. I think that you mentioned preventative health when we first started. Like, those are all things that we can do to make sure that if there is something wrong, we can catch it early and quickly, or make sure that you're okay.
So when we talk about that, how can we get more people to accept that and start coming in for those screenings and prioritize that, especially in communities like ours? A lot of, I know I'm 30, a lot of young women like myself and even younger, and I know it affects women younger than myself too, but a lot of us don't think that it will. They think that we're too young to get breast cancer, we're too young to deal with that. So how can we reach those women? And I know it doesn't just affect women, but how can we reach that younger generation to encourage them to come in and get those screenings?
I think we all have to advocate for our friends and family.
Okay.
I mean, that is huge. Advocating that they get a primary care specialist, family doctor, making sure that they're linked into those resources so that they are making sure that they're getting their annual testing every year. But all of us coming together here, all of our resources, all of everybody that we know, like, I want to advocate for you to make sure that you're doing those things every day. And we should be advocating for our families.
Yes.
And I know, like, some of our old school family, they're like, oh no, I'm going to be fine. I don't need that. But I think that, Lucas, you mentioned it, earlier. You don't need that until it's too late.
Yeah.
And we can stop that.
Absolutely. Absolutely.
Yeah, that is great. You guys, we're going to take a short break. And we'll be right back after this. Okay, we are back. As you guys know, with any live show, things can go a little off. So we reset like that. Like, that can go wrong.
And it's funny because a lot of people, you don't see, number one, people don't do podcasts live. And this is a live news show. And a lot of people don't do things live because it is challenging because a lot of things can go wrong. But we have a wonderful team. Shout out to our team who stay calm in the background. Sometimes you see them jump on screen to do something. That's what it takes to keep things moving on something like this. And we just want to appreciate Tiff, Liv, Brandon for being here in the background, keeping things moving. To our panelists who keep things moving. To our executive producer here, Danny, who makes this show happen. There was a lot of moving pieces. To the Strong family who helped also executive produce today. They put together a lot of pieces here today.
And I am so proud of Sean. I was looking at these questions. I said, well, how about that? You're better with your comprehensive questions. Exhaustive.
Man, exhaustive. We're not asking all of these questions, but it is exhaustive. There's 47 questions, but still.
I'm very proud of him for collectively
He did a
bringing
good job.
something together that would, touch everyone.
It did.
It was very good. He worked very hard. Good job.
He did a
Great
wonderful
job.
Yes.
So we're still on the topic of cancer prevention and behavior change, and we're gonna move to cardiovascular diseases and hypertension here soon. But my last question about just cancer prevention, what do you guys think are some cultural barriers that prevent people from just talking about cancer and talking about the risk and the prevention of it? And can I ask you that?
Yeah, I think the biggest thing is just not wanting to know. I think that's a big barrier that a lot of people face. They don't want to get that diagnosis because that's scary to them, and they don't want to have to face that. So I think that's a big thing we have to advocate for the people that we interact with or the patients we see, is letting them know, hey, it's important to get this done early so that we're not jumping right at it when it does happen.
Yeah. Anybody else?
I would agree with that. I mean, I see that all the time in my world of diabetes and nutrition, and it's kind of a lot of people have that out of sight, out of mind mentality, and then it really can sneak up on you quickly. And so this idea of prevention and really advocating and getting people on board with that, and letting them know that it's okay. It's better to do that than be on the flip side and having to deal with the.
So I think I have two more questions, and then we can go on to the next.
You said you only had one.
Topic. What'd you say?
You said only one.
I know I did, but another one popped.
And what's up to the people in our comments, real quick? Just hello.
Yes,
So many
y'all.
wonderful people. Thank you guys for your comments. Keep chatting. Keep saying hello, Serena. We see you out there.
Hey, Serena.
Hello.
Jean, hello. Beacon
There are all
Charitable
kinds of
Pharmacy.
people that I've never
Hello,
seen.
Lindsay.
Hello.
Hello.
Welcome to
Yeah.
the show.
Thank you
We're
guys.
so happy
Keep
you guys
commenting.
are
Let us know
here.
you're here.
Okay, so we're talking about, just that fear of finding out. That's what I'm going to call it, fear of finding out. And I don't know, sometimes when something is wrong with me, I do run to like Google sometimes, and I shouldn't. But if someone is at home and they're feeling some different things with their bodies, are there any things that we can look out for and maybe feel for? If we think that something is going on with our bodies before we get in there, like any indicators or signs that we should be looking out for?
I mean, most people know their body's the best.
Yeah.
So you're gonna know if something doesn't feel right. I mean, trust your bodies.
Yeah.
And if your body, you feel a lump, there's discharge, there's something that's different. Sometimes it's not you that's noticing, but it's your partner that's noticing. I mean, and listen to your partner, listen to your body. And if there is something different, then tell your doctor that, hey, I've noticed something that's different. And they'll help get you on that right path.
Yes. Yeah, I love that.
I think that's a real quick, interesting statement. Your partner might notice something different with your body, right? That's a fascinating statement. You're intimate with someone. Intimacy. Yeah. They notice you. They touch you. They feel you. That can't be a taboo thing, Like, it's not just pleasure. It's like, they should be okay to say something is a little off, and then to give permission to say that. I think that's something that people don't talk about. I don't know why we allow that to be such a taboo thing. To make that a thing, that's not something I've heard a lot of. As a man, it's not something I'm like, I could see maybe my wife saying, if she thinks something's wrong, she might ask me, hey, babe, do you notice this? Hey, what's this on my arm? Hey, But I wouldn't necessarily be checking myself or feel confident enough to say something, because I never want my wife to think I'm judging her, But it's like, no, everything's perfect, babe. Everything's perfect. I always want to act like that. But heaven forbid there is something wrong. Or even her to me, like maybe it's something, even it could be a sudden weight gain. It could be any number of things. But I think so often with our partners, we're always trying to encourage them and make them know we love them no matter what. But there could be some health risks and health concerns that we need to be loving enough to speak up and say something. Because even signs of depression, sometimes we may not want to say something, and there may be irregular eating habits or other things going on with them that we're not willing to speak up out of love and acceptance, but it may be signaling something else going on with them that maybe we need to speak up and say something.
Yeah, absolutely. Sometimes love is saying that hard thing that's really awkward.
I love that.
Yeah.
I love that.
Yeah.
Thank you for saying that.
So my final question for this topic is, if there is somebody that is dealing, I do know someone personally. So there's someone out there and they're dealing with cancer, okay? They don't have insurance, and they think that when they go in, they're not gonna be able to afford their treatment. So right now, they're just not doing any treatment, okay? Is that true? Is someone that doesn't have insurance, is it true that they cannot come in and receive the treatment they need for cancer?
Not at all. Yeah, there are so many resources that we have as a community, as a hospital system. There's so many things that we can do to help get women on that right path, to help with expenses and coverage and testing and all the things that go along with it. Okay. So I tell people, please never let cost be a reason you don't tell your doctor or someone about a health problem, especially when it comes to breast cancer.
Well, thank you for that. Thank you. So we are going to move into cardiovascular disease and hypertension. And so we're talking about the heart, all right? So heart disease is the leading causing death in the U.S., but it's largely preventable. Why aren't people taking action, especially when it comes to their heart? Nicole, can you answer that for me?
I think it's the same thing that we were discussing before, the fear, we are supposed to know our bodies the best, but some people aren't really paying attention to their bodies, and things like that. And I really think that that's really the bottom line. They don't have the resources. They don't know where to turn, or they don't know what questions to ask.
Yeah.
And so that, I think, is part of the problem.
You guys agree?
Absolutely.
Yeah, I think you brought up a good point about like not knowing what questions to ask. I think the education piece is a huge part of it. So as providers, helping these patients feel comfortable asking those questions and knowing what to ask and making them feel like they're being heard so that we can help them.
Yes. Okay, I love that. Lucas, you got anything to add to that?
Well, I always have something to add to that. No, but I know I really do appreciate it. Shahidra, I think I'd love to hear from you from a strong family point of view.
Yes.
What would you say? You think about cardiovascular health
I think we have a misconception, once again, that if you wake up and you feel good, there's nothing wrong with you. And we've seen a huge push for this. So as a mom, I have athletes, right? You have athletes. We know, there are lots.
I am an athlete. Still, 42,
you are.
Still an athlete.
Danny definitely is. Did you see her that day on the show where she did the thing and
On that iPad kick?
she jumped up from squatting, but she jumped up.
Danny did a walking handstand across here the other day. Out of nowhere. I never knew she could do it. It was weird. She
I
can
know.
do some
It's
odd
crazy
things,
how
yeah.
athletic she is. Who knew? But I think with our cardiovascular health, I think there's a push and a need right now for our younger children, especially the athletes, to start looking into heart health at a young age. And it ties a lot into what we are putting in our bodies. What are we putting in our bodies that's either strengthening our whole body, heart included, lungs included. We always tend to look at the troublesome areas as the only area. And having family members who have passed at young ages from cardiovascular diseases that are unseen makes it so much easier to say, just because you don't feel it and you can't see it doesn't mean that it's not there. It doesn't mean that it's not there. And it takes, I don't know, this is a panel of health professionals. Somebody can correct me if I'm wrong. Maybe a good 10 minutes to get an EKG to check on your heart. Maybe. I don't know. I don't know. They put the thing and the thing and the thing.
Will we accept that answer? Will we family feud?
Right, family feud. Is that okay? Everybody clap.
That's a good answer. Family feud says.
But we tend to think that it's not there.
Yeah.
And I think that goes into a lot of fear. That fear, like you said, Danny, of just not wanting to know.
Yeah.
When I had, when my younger cousin passed away from a cardiovascular disease as a healthy athlete, no one would have known. And now we're advocating for these kids at a much greater capacity now, getting them more thorough care before they start exerting their bodies in really cool ways. Because athletes are fantastic. We love to watch them. But we have to be able to pay attention to stuff like that.
Your husband said, "That's my wife."
That's my wife right
I know
there.
that's right. Y'all, I'm gonna have you guys clapping one more time, okay? So I'm sharing this because she has shared it. My sister has shared it on her social medias. My sister deals with a condition called POTS.
Tiff, who's right over here.
This is a
Producer
cardiovascular
over here.
condition.
You look good, Tiff.
Yes, our Tiff over here.
What I want
Hey,
to
Tiff.
say about advocating and knowing your body, my sister dealt with her condition for 2 years before someone said and diagnosed
Before
her.
a doctor properly.
Diagnosed her with
Yes.
POTS. She has undergone 2 ablations on her heart to keep her healthy.
She's
And
25.
She's 25 years
Just
old.
now,
Okay,
yeah.
and for the people out there, she's 25 years old and she is dealing with a heart condition. And sometimes it's hard for her to get out of bed. It's hard for her to just be in a good mood. Like when you are dealing with all of those things, because with her I've learned so much. It's her heart, but it's other things that are affected. She's tired or she's moody or she's over sweating. I don't want to share all that.
She's very clammy and sweaty right now.
Did you share that on
I'm sorry.
social media
She's
too?
overheating. One of the things that almost fascinated me was the doctor told her, because she was losing a lot of weight. So the doctor told her because her heart rate was going up so fast and then going back down, going up so fast, it was almost like she was working out. So she was losing weight. And so she was dealing with the weight loss and all of these things that played into having POTS. And because she knew her body and was advocating for herself, she did not take you're okay for an answer, you're no for an answer. She went to doctor, to Cleveland, to Akron, to Kent, everywhere until she got her answer. So continue advocating for yourselves because, just because, it was just fascinating to me about, her heart and then the other things that it affected. I think learning that, she now is on TikTok trying to let others know. And it's opened up a whole world of just POTS and me learning different cardiovascular diseases. So real quick before we go to the next thing, I want everyone on the panel to debunk one heart myth. So there are heart myths out there and people are saying that, I don't know, all types of things. So I want you guys, we'll start with Annie, right?
Yeah, put me on this.
I'm sorry. We're going to go down the
table,
line.
I need to think
We're
here.
gonna go
I know, I'm
down
like,
the
oh, what
line.
am I going to say?
What's one heart myth that you just don't want to hear anymore? You're ready to debunk it? That's not true.
We need some Jeopardy music.
Yeah, that's that I don't want to hear anymore. Well, maybe I'll just flip it on you.
Okay.
Maybe we need to talk about myths so that we can correct them, so that we can educate, the community, educate folks about myths to tell them that they're wrong.
There we go. All right. I love that one.
That's a hard one to follow. Dang. I don't know if we consider it a myth, but I think people only think, the only reason I would have to go to the doctor for a heart issue is because maybe I'm feeling chest pain. So they don't realize all of the other things that, can be happening if you're having a heart attack. Your back hurting, your stomach hurting, your jaw hurting, your arm. Like, people don't realize, my jaw is weird and off. Maybe this is an indication that something is wrong, and that could be a heart attack. Does it mean it always is? Absolutely not. But we ignore those little things that our bodies really are starting to tell you something is not right, and we need to be paying attention, because in heart health, stroke, anything, the sooner you get that care, the better off you're going to be on the flip side as far as not having damage and healing.
That's really great. Really good.
I think from my perspective as a pharmacist is like patients not wanting to take certain medications, and I think the non-compliance and just being afraid of side effects is one thing that defers patients from wanting to be compliant with their medications. So there's a reason why your doctor's putting you on certain things, and yes, every medication has a side effect, unfortunately, that we may have to deal with, but the benefits of them are going to outweigh the risk of those patients. So patients read things online. Patients will hear things from friends.
That commercial.
Dr. Google is not always your friend, right?
I think having a reliable resource. I know, like Danny, you were saying that people go to look things up online, like after they find something out. Because I'm guilty of it too. Yeah. But relying on like a healthcare professional is probably the best source of information.
Thank you.
I think making sure that people know that there's a difference in how heart disease symptoms present with men and women. It's not the same sort of crushing chest pain that, a lot of times men will present with that, but women can have other more subtle symptoms. Sometimes it can be jaw pain, sometimes arm pain. And so men and women present with heart disease, heart symptoms differently.
Wow. Okay, I didn't know that. Yeah. And you guys will be proud of me because I actually have upgraded from Google and I use ChatGPT to look it up.
Okay, I like that. She's using AI now.
AI now.
Yes.
I thought you were going to say something really good like WebMD. No.
She's ChatGPT.
Now I go to AI.
Y'all hear the initials at the end. They're certified.
Yes, they're certified. PT. Physical therapy.
I'm loving the conversation, and I think the comments are reflecting the same thing. If you guys are loving what you're hearing, make sure you guys are giving us some hearts. Share the broadcast. Invite someone to come and join the conversation. We are still talking. We're getting ready to transition to the topic diabetes prevention.
Oh man.
And management.
They're like, it just got tight in here.
So we know that diet plays a really big role in diabetes, but what are some less common factors that go into diabetes and prevention? And we can start with Mr. Brita.
One of the things that we see that's an uncommon cause of diabetes is unfortunately something that people have no control over. There can be viral illnesses that cause insulin-dependent diabetes. And so that's unfortunately something that people don't have control over, because we're all getting exposed to viruses, unfortunately, especially if you have little ones. But they're everywhere, but also realizing that, hey, that could be why, you know, so-and-so hasn't been feeling quite right? I mean, and it's not because they're eating unhealthy or doing any of the other things, but I mean, sometimes those things happen.
Okay.
Interesting.
I think family history as well is a big thing. So having both parents or one parent increases your risk of diabetes. So.
Okay. All right. What other factors do we just not think about or talk about, or just maybe less common?
Well, I do think that people, when they think about diabetes, they only think, oh, it's only about what I eat. That's the only thing that affects my blood sugar. And people don't realize how many other things can impact your sugar. If you're not sleeping, you know, medications, timing, you know, all kinds of things. You know, caffeine can make your sugar go up, you know, if you're sunburned, like the inflammation, like little things that people don't realize, and then they're only focusing on their diet, and it's something completely maybe different that is impacting them. And to what doctor said, you really need to kind of pay attention to maybe thinking sometimes outside of that box of just that. And sometimes it's things that it's completely out of your control. Pancreatitis, if you have liver function problems, those are all impacting how your body's ability to control your sugar.
I just want to say that Lucas tried to shade me because you said caffeine.
Shahidra has a bit of a caffeine addiction.
Okay, but wait, you know, I feel like Danny, I have really upgraded my life. I have gone from drinking Red Bulls. I am Red Bull free, like years Red Bull free. Thank you.
We're very proud of you.
Yes,
You're now on Celsius and Dunkin' and Starbucks and
there is
CS Nutrition. Shout
We'll
out
talk
to them.
later after the show.
Thanks.
Yes.
This is CS Nutrition
Shout out to
today.
them.
Thank you very much. I have not even had coffee. So for those of you that know me and know me very well, can you imagine how I am right now? I have had no coffee.
Good job. You're doing
thank
good.
you.
You're doing good.
I am here.
She keeps
with
a little
smile on my
caffeine
face.
in her cheek. She keeps a little caffeine patch. Is what she keeps. She does a
It
little
does.
something. Okay.
But I want to mention this because Dr. Snodgrass, she said stress. And I know, and Sean told me to be transparent about my health journey as someone who has struggled in between that line of like type 2 diabetes, pre-diabetes, those types of things. I always thought, to your point, Nicole, I always thought, oh, it's just because I'm eating bad. And when I stop eating like, you know, fast food, or I stop eating late at night, or I stop pushing myself, I'll be fine. And now I'm coming into this space where I totally understand that the stress that my body is under just causes it to react differently. It just does. I could have a salad and no caffeine and still be stressed. So I really want us to kind of dive into that when we talk about the prevention as well. What are some of those preventative measures that we can take to manage the stress in our lives, to really just go beyond saying, let me fix my plate and not the rest of my life. Like we fix one plate and overcrowd the other one. And I know that's me. I'm totally guilty. Like I'll
That's
fix my
deep.
food plate and then my
Life plate is
is
full of
now
stuff.
like full, and then there's stress on this end, but I'm eating greens.
Telling people off here.
I'm not. I'm only talking to myself. But you
No,
know, I
sounds
have.
like all of
I am
us.
a recovering Red Bullaholic.
Okay,
And, you know, so I can say
Yes.
that.
But you're busy. You're a mom.
I am.
You have a lot.
We-
when I see you, I'm like,
Usually
yeah,
with a cup of
with
coffee.
a cup of coffee,
Right.
kids,
No matter the time of the day.
right off of work. I see a lot going on. So
Yeah, it is. But I do want us to, in this conversation that we're having today, because that's something that's really big in our community.
Yeah.
And as we move into the next group too, the next group that we have is an amazing group as well that will really talk with us about what Stark County is looking like.
Yeah.
These are all healthcare professionals that don't serve outside of our city limits. They serve here, which is why we wanted to bring people together that serve our community,
Yes.
that serve us here. So you know their faces. Their names are no longer just foreign names on a piece of paper or a referral, but you know them now. So, yes, recovering rebelholic here. And, you know, I'm just stressed. That's
Hold
all
on,
it is.
Shahidra, that was a great point because
Yes.
we also have a Mayor's Corner here on the show. We have Scumba, like a Scumba business and beyond. We highlight a lot of the things that happen in the city, and being a Canton native, I've born and raised here. I've gone to Shipley's Clinic when I was younger. You know, I've been to Belden School, Lehman. I am in the community. I've been a part of it my whole life. And the comments you made about just seeing their faces and getting familiar with you guys, I think that is
matters.
so
It really does.
important.
It really
and
does.
it matters so much, because when I go into a doctor's office, or it's time for me to go and have a, God forbid, a surgery or anything, if I go pregnant, I go in and I see one of you guys, the comfort that I would now feel, because have been able to have a conversation. Y'all have come to my studio. We have gotten to meet. I have babies that I have to bring to you guys to be served. So that is a great feeling. And I'm glad that you guys are all on the show to see the community and the people, and then them can see you.
Yeah.
Because I think so many times we get caught up in titles, right? We get caught up in doctors, but
You guys
aside
care.
from doctor, you're
Yes.
a person
Yeah.
that cares.
It's
You
about
went
people,
and
yeah.
you took those classes, and you
all
got
those
those
years you
degrees,
dedicated
and
to-
you dedicated your life to this. So to look past the title and look at the person that's giving me the care, and I think health matters, and I think that's what this show is all about too. It's just connecting us with the community. So I hope you guys are receiving all this, taking it in, and when you see these people out in the community, you can at least rest assured that they're here for good reasons.
Yes.
And you can see a familiar face because of Lucas Live. So I just want to make that real quick.
Yes.
But we didn't miss any. What is one thing that you think is less common or less obvious when it comes to preventing diabetes?
To preventing diabetes?
Yes.
So my stepdad had diabetes, and he was a non-compliant patient. He'd self-medicate depending on what he would eat, but not only for the patient, but I think that it was the impact on our family. So, I think that people don't see that, when you can't help your family member and you can't get them to listen. I think for us and maybe for everybody else too, is there are so many resources in our community regarding diabetes, whether it's a diabetic nurse, a diabetic coordinator, a nutritionist, and just wrapping those services around patients or your family members to help them is huge. I think the other thing that I'd want to add is for diabetic patients, they're prone to wound issues.
You're right.
And if they have that, it can turn into something big. And so a lot of our older patients, they just kind of ignore them until they're too late. But I don't know if most people know that you can go to a wound care clinic without a physician referral. So you see a wound on your foot and it's small, like go get seen, because that can turn into something bigger if it's not treated.
For sure.
Right.
Thank you for that.
Thank you for that. Yes. Wonderful discussion. I think this has been
going
great.
Yes.
Our panel group one has been phenomenal.
Absolutely.
Yeah. So I don't know. I know we're going to have to get to panel 2.
All right.
Group 2.
Well, first I want to thank you guys for coming on. You
Yes.
guys are so informative. You guys are so poised. You guys did a great
And
job.
we hope you guys become friends of the show.
Yeah.
I think Wendy Williams used to have friends of the show. They come back. Come back sometime. That you guys don't become strangers, and that maybe even individually come back. And when there's topics or things going on with your own organizations, that you guys reach out to us, and that maybe this becomes a more regular thing for us as we have the SCUMBA and the Mayor's Corner and things, that we'd like to make sure that health continues to matter, because it certainly matters to us in our community, and that you guys could be representatives for that in sharing that with us. So.
Thank you for
Thank
having
you
us.
guys so much for joining us.
Thank you.
We
Thank
are
you.
going to kick it over to our SCUMBA and Beyond. We're going to hear from Lydia Lee, and we'll be back with our second group, and we're going to be talking about substance abuse, community action, mental health, and general health. We'll see you right back.
Hi, I'm Lydia Lee, Program Director for the Stark County Minority Business Association. I'm excited to share how our Expanding Resources for All, or ERA program, is transforming the game for minority, women, and veteran business owners. Since its launch, ERA has provided critical resources, mentorship, and networking opportunities, helping businesses break down barriers, access new markets, and achieve sustainable growth. It's not just talk. ERA participants are seeing real results, from increased revenue to expanded connections that open new doors. To date, we've distributed over $239,000 in grants to empower minority-owned businesses. And this year's 2025 cohort is diving into an even more dynamic program with tailored tools and support to help them scale and thrive as never before. If you're ready to take your business to the next level, becoming a member of SCUMBA is the first step. Learn more about ERA program and apply today at our website. Let's build a brighter future for your business together.
All right. All right, we are back with our second group. And I am so excited. We're going to do the same thing we did last time. We're going to introduce the panel. Tell us your name, where you're from, who you're representing, and then why health matters. And we'll start with you at the end.
Okay. I'm Michael Graves. I'm a family medicine physician at Cleveland Clinic, and why health matters to me is because, much like everybody has said before, we only get one life, we only get one body, and why not make the most out of this? You want to experience wonderful things throughout your life, so take care of your health, and you can do so.
Love that. Love that.
My name's Kay Rega. I'm Executive Director with NAMI Stark County. We're the National Alliance on Mental Illness. So not only is physical health important to me, but mental health also. Have a wide range of generational family members that have struggled with mental health issues. So that is a path that I've been on, I guess, for most of my life. And it's very important to me to make sure folks have quality of life.
Thank you, Kay. All right, we'll go over here.
I know, look, we all look down.
Like the wave.
Hello, everyone. I'm Dr. Latrice Snodgrass. I am the CEO of Beacon Charitable Pharmacy. And health matters to me because without health, we are not, right? So if we don't have good health and focus on our health, then the world will disappear, right? That's dramatic sounding, but it's true. Like we don't want to just live long. We want to live long with a quality of life. Right. And if you don't focus on your health, then that will not happen.
Absolutely. Hi, good morning. My name is Amanda Archer. I'm with Canton City Public Health, and health matters to me, echoing everyone's comments, because it is our greatest asset. And so, I think that there's a spectrum of health optimization that everybody has, but it's unique to them. And so taking ownership over your health status is empowering, and it allows you to do even more. So, losing health status can really affect every other aspect of your life. So it's really important to focus on that to do better in other aspects of your life.
I love that. I think that's a great call out, because losing health status can affect everything, even simple things like, you twist your ankle and you're like, I'm not the same. You're trying to do that fake walk. Am I the only one who's trying to act like I'm normal? And I'm at the store trying to play it off. I got that little limp going on. Or you're not feeling well. I know one day I was here and I wasn't feeling well. I was, this winter was rough. I don't know about anybody else, but I got that thing that cough, that something in my chest. It was like a month, and I was trying to play it off and I wasn't feeling well. And then I got better, and I didn't realize how bad I was until days later. And I came back in here and they were looking at me like, no, you were down bad. And I was like, I didn't know. We did a whole show and I was sick and I didn't realize it.
He scheduled meetings on different days.
Yeah, I was all confused. My calendar was all off. I was really not doing well. But it impacts us, and we have to take care of ourselves. And health matters. I mean, for everybody out there watching, and there's things we can do to take care of ourselves. I think that's why today matters so much. I think what the Strong Family is doing matters so much. I think, again, to shout out April 12th, 10 a.m. to 2 p.m. Yeah. Everybody needs to come out to the vendor show, to the wellness fair. Everybody needs to come out, and many of these people are going to be there as well for you guys to meet them in person. So you guys want to do that. So, Danny, what other questions do we have? Again, Sean did a lot of research for us to give us 21 questions, and they're all about us. All right.
I'm really excited to have this conversation because substance abuse is something that affected my life. I had parents that dealt with alcoholism. My mother has been sober for 6 years now. Yeah, shout out to her. She was in the chat earlier. But when we think about substance abuse, I've seen it my whole entire life. I've seen people abuse alcohol. I haven't seen any other drugs, but I've been around that. And when we think about substance abuse, is there a deeper reason why people are abusing substances? Is it because they just love alcohol, they just love the drug, and they just want to just overdo it? Or are there deeper rooted issues that are causing people to become addicted to these things? Does anybody want to start with that?
Yes, there are a number of reasons why anyone could become more dependent on something. Dependency oftentimes comes from a place of lack of control or even escapism. Life can be hard and painful, as everybody knows. And so sometimes these substances allow us to escape, even if it is just for a moment, that pain and that suffering.
Yeah. Great point. Anyone else?
Anybody else want to answer that?
I would just agree that sometimes there's a link between mental health issues and substance abuse. And I refer to that as kind of the chicken and the egg, which came first. Are folks self-medicating because of a mental illness, or did mental illness trigger an addiction? So that's kind of, we see that a lot in our community.
And when we say self-medicating, that can be various things, right? And I've heard several people say that already today. Self-medicating could be alcohol.
Could be alcohol.
Could be
drugs.
Could be drugs.
Could be food.
Okay.
It could be any type of behavior that becomes addictive. Gambling. There are just a lot of things that could result of mental illness or substance abuse.
Interesting.
Okay. So go ahead, yeah.
Well, I was just going to add, we've learned a lot about addiction, and it really is a brain disease. And so one of the things that we've learned is that when somebody is using, they're chasing a dopamine rush, right? And so from a neurobiological standpoint, we're all addicted to dopamine. And that's the feel-good chemical. It's the chemical that makes us feel good after we have that big meal, after we hang out with our friends, or we go to a comedy show. And so when people are using, it actually reduces their ability to produce dopamine, so they don't get that high.
That natural.
So they chase that. And so, a lot of it is kind of driven by these chemical interactions in our brain, and people don't really know, but that's kind of what's happening kind of under the layers or behind the scenes. So I always tell people we're all addicted to dopamine.
That is a great
Just
point.
depends on how we decide that we want it to be delivered to us.
That is an excellent point. I've never heard anybody say that. We're all addicted to dopamine, so thank you for calling out my addiction, my strange addiction. We're all addicted to dopamine, and we become desensitized because of things that we're feeding it, and which is why social media has become such an issue for our teens, because that like button, those hearts, that response,
100%.
it becomes. That's what Lucas Live started. Probably this may be our anniversary, literally, April 2020. My mom passed away March 26, 2020. Around this time, 2020, I started doing this, grieving my mom's loss. And one of the first things I had to do was get over how many people were watching me. I was doing this in my basement, and I hit go live. I had some little mic. I didn't know what I was doing. I had no idea what I was doing.
It was a very tight space.
It was a very tight space. It was a 10 by 10 room, probably like the corner over there. And I was like, hey, everybody. And nobody was on. None of you were watching. I don't know where you were. And my feelings are hurt, just so you guys know. I won't hold it against you guys. You guys weren't watching me. But one of the things I had to get over was I kept telling myself I have to keep going in spite of who's watching, because I have a greater purpose. But if I would have watched the views, I would have stopped a long time ago, because I would have been addicted to the likes. And even now, I challenge myself not to care about how many people are watching. I care about how many people are impacted. And so today we hope a lot of people are watching simply for the impact, not for some vanity metric that they're watching me for some reason. So that's a fascinating thing. We're all addicted to dopamine, and we can get that from some places that can start to trigger us in the wrong ways.
Yep. And I think that we don't talk about stress enough, right? So life is hard. Life is just out here lifing. And a lot of times you'll hear folks say, I just need a drink after work to just relax and I'll calm down. And then pretty soon that becomes a habit because life is hard. So I think that it starts off as something, well, I'm just relaxing. I'm just unwinding. And then you notice, okay, now wait a minute, I done been unwinding every day after work.
I'm way unwound.
Yeah. And then,
You all unwound.
and then to Amanda's point, that's when that dopamine kicks in, right? Because now I'm chasing that unwinding feeling.
Or
That's
now
so
you
good.
like you need that to unwind. Like when I'm sitting down on my couch, I need my glass of wine. I need my.
Yeah, they
it's a
start to-
part of my need for this relaxation moment. My next question, like you guys kind of
really
like
good.
hit it all on the head. I was gonna ask about like the misconceptions of addiction, but you guys kind of like hit on some of those things. But are there any other things you would like to add about the misconceptions of addiction? What people are just looking at and not quite getting?
So I think a lot of people are, and you're right, we already kind of touched on that, is, like you said, the dopamine reward pathway, but also that people have gone through trauma.
Yeah.
And that trauma plays a huge role into how they experience life.
Yeah.
And so a lot of times if we get to the source and start the healing process, we can kind of get away from more destructive habits that can lead to addiction.
And I think a common misconception too, from a non-clinical standpoint, is, that it's only one time, or I'm only doing this for right now. And that it'll be okay. I can't stress that enough, because the stress of life you either decide like I'm gonna muscle through this stress and be okay, and then you're misconceptualizing how much you're actively looking for something everywhere, and then we find ourselves falling into really sunken places looking for that outlet, and we just don't find it sometimes, which is why, to what we do with the weekend, like a lot of people find that when they work out.
Yes.
And sometimes they find it in the actual physicality of the workout, but I think I find it more in the people, the community of us all being together. I told someone the other day, like, we're gonna sweat, we're gonna laugh, we're gonna cry probably, and do all the things together because we're looking for that happy place.
Yes.
And the common misconception is that you may not be able to find it unless you're doing one particular thing. And then when hopelessness kind of sets in, to Amanda's point, and your brain is telling you, I need something to find it, but then what I think I'm finding it in actually brings it down. Now I'm counterproductive with what I'm doing, and I don't even realize it because I'm so busy chasing that I think that's where the fun is. And it's the same thing even with being healthy and working out. I think as clinicians, they can all speak to this, and healthcare professionals, you can think for a moment that I'm chasing being healthier, and you're really not even being healthy.
Wow.
You can.
If I had a mic, I'd drop it.
I know, right?
Don't drop
We
your
can't
mic.
drop any more
Tiff
mics.
will not gonna have
I
a
know
mic.
Tiff will shut it
I
down.
know, right? It's
Shut it
just
down.
so run out of
Have we not had enough mic issues?
Not touch that microphone.
No more mic dropping.
I want to look at it from the misconception from a different angle. I think the greatest misconception from my vantage point is that addiction is a choice.
Yes.
It's an illness. It is no different than heart disease, hypertension. It's not a choice. It may have been a choice before it became an addiction, but once it becomes an addiction, it's not a choice. And what we tend to do is not take care of ourselves when the word therapy comes up, right? And we bury it. We don't want to deal with it. And for some folks, Black and brown people, it's another deficit, right? So I'm not going to a therapist. So it's not, people don't want to be like that. It's not a choice. So we have to start removing that stigma that's attached to therapy. Rather, it's for mental, and a lot of folks, and Kay can attest to this, it's dual diagnosis. If you have an addiction, you probably have some mental health going on, right? So I think that we have to normalize folks going to therapy and unpacking the things that got them to that point. So
That trauma.
it's not a choice.
That was a lot.
Excellent.
Go, Doc.
That was, and now
Someone throw
you
that in
set what I'm getting ready to say up so perfectly. So again, you guys know that my parents dealt with alcoholism, and my next question is like, how can like family and community support those people? But I want to tell you guys what I did to support. We tried to call like family meetings, and we tried to like have them sit down. There were times where I was just because when you said it's an addiction and not a choice. You know, I had to learn that growing up so I could forgive my parents, because I believe that
They were just choosing
they
it over
chose
you.
to do that.
Mhm.
I literally said out of my mouth when I was younger that I told my parents, because I thought that it would like strike a nerve in them to stop drinking, but I told them that I felt like they loved alcohol more than me. And I thought when I said that they would be like, I'm putting this bottle down, but I'm not going to do it again. And honestly, it hurt my heart to see them pick it up again, because I felt like they validated what I said. And I was like, I can't do this with you guys anymore. At that point, we had already done, try to do like mediations and bring family in and do these things. And I felt hopeless, and I did. I gave up on my parents. I gave up on them because I felt like, okay, you guys are adults. You guys are choosing this lifestyle, and I don't want to choose. I'm not choosing to live in this with you guys. Now, since then, I have learned a lot about addiction. I went to college, and I took all types. I've learned a lot about it. Now, from your guys' standpoint, what advice could you give to someone out there that has parents or a family member or a friend or a partner that is dealing with substance abuse? What can we do to help these people that we love? Because it's an addiction, not a choice. So because it's an addiction, and to say too, we've tried to check our parents into certain quests and conquests and things like that. My dad went a few times, but it just didn't stick. So we kind of felt like we were at the end of the road. There was nothing else that we could do. What do you guys say to that?
I would say, first and foremost, patience. It's a process because it is an illness, and so it does need to be treated. But there has to be a willingness to treat the illness, and we have to kind of give them room to work through that, because that's a lot. That's a lot for them to try to work through. And also, I would say take care of yourself in the process too, because as much as you want to take care and help them, do what you have to do to take care of yourself in that process, because then you have the patience to work with them as they work through this.
That's
great.
Thank you.
And I would add, I think sometimes we overlook the fact that addiction is a family disease. It doesn't just affect the person who's dealing with the addiction, it affects the ecosystem in which that person lives.
Yeah.
And there are supports out there for people who have a loved one who's dealing with addiction. And I also think it's important for the people who have a family member or a loved one who's dealing with addiction is that we are rationally thinking and trying to rationally help somebody, but their brain is not rational. And so they're not taking the information that we're providing, and that's the frustrating part, because there's a conflict. And we're trying to rationalize with an irrational brain from a chemistry standpoint, and it's very difficult. On a positive note, recovery is possible, and people do recover. And the percentage of people, or the rate at which people recover is in line with other chronic disease. And so I think if people who are struggling with addiction, if we reduce the stigma, like Dr. Snodgrass had stated, and they see that there's hope, then our rates could go higher and people might reach out for treatment. But it is up to the individual, but as a family member, to Dr. Graves' point, you have to take care of yourself. Yeah.
And I think that, so I have a really dear friend whose son is living with addiction. And he's like a nephew to me. And every time he goes and he falls, it's traumatic, it's stressful. This may sound a little harsh, but the only way to help folks change behavior is to have a consequence to that behavior. So it's hard, but tough love has to sometimes come into play, because if I'm able to live in this addiction and I don't have any consequences, why would I stop? Right. So we have to,
the fall every time.
Especially as a young person, right? Because there's consequences as you get older. You can, you can get into a car accident, you can get pulled over, any of those things. So, go ahead.
So my friend has had to pull back, not give him the $20 when he asked for it. Let him be homeless because he's not paying, and it's hard. But if that behavior it remains comfortable, I have no skin in the game to change, because I can just keep doing what I'm doing.
You're funding my.
That's
and
a great
it's
point.
hard.
Excellent
That's
point.
easier said than done, but there has to be some tough love in there.
That you are absolutely 110% right, because even now I have to show some tough love to people, because they do want to come and sleep on my couch. But I just can't allow that. I got 2 boys and a whole family at home, you know? So what does my heart want to? Yes, I want to, you know, get the freshest blanket I got, my fluffy pillow, put you down there, what movie you want to watch, are you hungry? I want to do that. But I also know I can't enable that behavior, right? Because if I allow you that space, then you know it's okay for you not to pay rent or not have a house, or it's okay because then I can go sit on her couch.
Yeah.
So that's
so good.
So we needed to make sure. I mean, because as a person like me, like I feel, and anybody feel bad if there's a loved one and they need you, but they're dealing with this addiction and you just don't want to.
I always think about carrying people, and I always think the thought that came to me was my son, little Lucas, who's been bigger than me for a minute. I mean, little Luke been. So he's about 14. He got taller than me, but
his name is just Luke.
It's just Luke. He's just a man. I'm my man Luke. He's 21. He big. That's my dude. But I was thinking, like, at some point, that was my guy, right? My firstborn child, right? And I'm like, if I had carried him until he got too big for me to carry, and I sat him down, he would not have the ability to walk. Walking is not a function of age. Walking is a function of getting the opportunity to crawl and have tummy time and the ability to lift your chest off the ground and move your head and crawl and learn spatial orientation and all those things that you build strength with, right? So sometimes we're carrying people thinking we're being kind and we're actually weakening them. And so the ability to sit your children down on the floor and let them crawl and toddle and fall and toddle and fall is what teaches them to walk. So sometimes the people we love the most, we have to let them toddle and fall, even as adults, in their addiction or in their problem, because one day that will allow them to walk and run and stand on their own 2 feet again. So I no longer carry adults because I know that I'm not actually helping them. I'm actually enabling them and stopping them from walking on their own. So.
And one of the hardest things as parents, especially when our children turn 18, is setting boundaries for ourselves. You know, letting them find out what those natural consequences are. So whether it's mental health, whether it's addiction, whether it's just general bad choices because that executive function hasn't developed in their frontal lobe of their brain till their mid-20s, is letting our young adults, letting our parents or loved ones with addiction or mental health issues kind of follow those natural consequences. So the only thing that we can change is how we react to a situation. The only thing we can do for ourselves is educate ourselves on the addiction or the mental health conditions. And we can also look for those supports, whether it's Al-Anon, whether it's a family support group setting, for whatever the topic may be. But we cannot change our loved ones' choices.
So good.
We cannot fix their mental illness. We cannot fix their addiction. So we have, going back to the first panel about stress and physical health conditions, I probably wouldn't be a diabetic if I hadn't had the 2 children that I'm lucky to have. And it's just, you know, a fact.
So right now, we are like in the opioid crisis. And we're talking about young people, and it is absolutely terrifying that I keep seeing 15 and 16-year-olds overdosing and passing away, and some of them just from fentanyl and these things. And it's absolutely, it's scary, okay? I have an 11-year-old and I have a 6-year-old. And it's scary because I seen like a Ring video of this young kid bringing his friend home. So it was on his porch and his mom coming outside. Now luckily she did get to him before he passed, but he was blue and gray and on his way, you know? And this is something that, I mean, it's scary. How can we, when we look at our younger generations, there's so many factors now. There's social media. There's all these things. They have to be cool. Back at, you know, when I was a kid, it was if you smoke a cigarette, you're cool. I didn't do it, but if you smoke a cigarette, you're cool.
Good job.
You know,
that DARE program worked, didn't it?
It did. I was in Kids Summit.
DARE was real.
I was in Kids Summit.
DARE was so real.
But the things that they're encouraging our young kids to do are so dangerous now. I mean, and the things that are out there, they're trying to buy like a certain drug and it's a fake drug, and then they're taking it, and these things are happening. So when it comes to our kids, what are some preventative methods that we can do to reach our babies before they get exposed and experience these things?
I think you've already talked about it. Get involved. Because ultimately, as a parent, which I hope to be one day, I think the biggest thing is making sure that we're part of their life. We're the first protection for our babies. Okay, so I'm an uncle, so I kind of can. I can have that father role a little bit. But yeah, so just making sure we are the first guard, and no matter how corny or out of date we are, being involved, our children will feel that love, and it does cause them to pause.
Yes.
And I think that's why I paused. I never picked that. I didn't want to. My parents smoked cigarettes too, but it never made me want to do it because they were involved and I knew better, right? I had that fear. I knew better. Don't do that.
I think now that we're in the age of exposure, and that's the biggest difference between all the generations, is the exposure. It has grown with the growth of technology and the growth of social access. So to Dr. Graves' point, that's the most we can do for kids now, is get involved and give them access. You have to give them access to conversations just like this. If my kids will never know how to do, double Dutch, and I'm gonna say double Dutch because I don't know how to double Dutch, okay? All you double Dutchers, keep your judgment for yourself. They will know how to go into the doctor's office and talk about what's happening with them. I took both of my older kids and took them to see my primary care physician. Thank you, Dr. Keith, because she's very honest with me. She will get me together. That tough love that Doc talked about, Dr. Keith, she got a lot of tough love. And I took my older two kids to see her because they're going through this age transition where now they're going to have to start having these abilities to speak up for themselves, where they have to have these abilities now to be able to come into an office and say, this is what I feel. I don't like the way this feels. Sometimes my nose twitches 2 times. Sometimes I feel sad. And then I want brownies. Like identifying all of these different things about themselves, but also being able to expose them to a space where health is not weird, and saying like, I feel good, but I still need to go get checked on is okay. And in the age that we're looking at with opioids, kids have access to that. What they don't actively always have access to is conversations like this, where they can meet a general public health professional that can say, hey, I understand that maybe you're looking for something to make you really, really happy. Let's talk about the ways that we can make you happy. They don't get access to CEOs of pharmacies where where a pharmacist, someone in that space can tell them, hey, you have to be aware of what someone may bring to you. They don't always get access to a primary care physician that can say, it's okay if someone encourages you to do something and you say no. Let's talk about what that does to your body. They don't get access to mental health professionals that can say, in the spaces where we chase likes and social love, let's talk about how that helps your mind. Does it help or hurt? And we have to start having these conversations at a young age with our children, not exposing them to greater things that they can't conceptually, because I think that's a misconception, is that kids don't get it. Oh no, they get it. They know. And I'm gonna be honest, my kids, the tough love in our house says, hey, if I bought a soda that I want to try, like a Mountain Dew, that's a new flavor, because sometimes I'd be like, ooh, I just want to try it. I'm going to have one sip and that's it. And they're like, no, you can't have this. I'm like, oh my God, why would you do this?
You don't love me.
Why would you do this? And they're like, no, we have to take better care of our bodies. That's not going to help our body. Says the person who asked me to buy Gushers. But these conversations where it's a normality to say, hey, you might be doing something that's not good for you. And let's talk about that. And these types of conversations are things that we have to start exposing kids to. We have to make health noise louder than the noise of social influences and the parameters to what they just see at their fingertips. We have to make it greater.
And to, I'm sorry.
No, please.
Y'all gonna kick me off the panel.
No, you're dropping gems.
I think to piggyback on what Sis said is when you ask the question, sweetie, what do we need to do? I think so. I'm a 70s baby. I was telling Doc that earlier, and we had a village mentality, right? There were things we just wouldn't do, we couldn't do because Big Mama down the street is gonna snatch you up and deal with you, right? We played outside. We didn't have all of this idle time. We're living in a different time now. So what worked for me may not work for this generation, and I think we need to ask our youth. We build things and say they just need to do it. This is what they need to do, but we need to ask them. So we need to start leveraging our youth in the manner to which they are not just coming to be a part of solutions we made, but they need to be give them the mic and let them be the solution maker, because we can then begin to unpack and digest what they need. They know what their peers are dealing with. They know where those influences are hitting. They know why their peers are smoking vapes, which now have fentanyl in them. That's just taking me out.
That's huge.
Ask them, leverage our youth, build up our youth. Let them be at the top of the pyramid, and we need to sit at the bottom of the pyramid. Direct and guide if things are getting off track, but let them know that they have the autonomy to help build the strategies that will then get us to the solution.
I was just going to say, and I think sometimes we forget that the youth of today are the adults in the future who are using. And so we look at the adults and we're like, oh, trauma got you here. Well, it's the same trauma. It's the trauma that the children had when they were youth and they grew up. And so, really focusing on how to support the youth and children. And we talk about naloxone being the antidote to an overdose. Community is the antidote to addiction. And so getting people in and invested and surrounded by people and community is really, really important, which all of the panelists have talked about. So I think that's a big part of success in supporting our youth.
Community is the antidote
I'm literally
to
putting that in the
Can everybody write that down? Community
that took
is
me.
the
I was
antidote
like, wow.
to
Trademark
addiction.
that.
Trademark that. I think I will, actually. Whoever wants to make money fast, let me type it into the trademark.com. Somebody get that. That is phenomenal. I have a question for you, or just a thought. I mean, I don't know if there's an answer, but we are we are currently in a climate where, and this is not a political statement, this is a reality, with tariffs, okay? Which means food costs of many things, everything is about to go up. So, I have a chef who works with us through our company Footage Fusion. He's putting out content now that is going to help people make healthier choices with tariffs. Because the reality is, costs of bananas are going to go up. So if the cost of a banana goes up, I might choose a Cheeto. I don't know. I mean, I don't know if Cheeto costs are going up, probably too, but maybe a Cheeto is going to be cheaper than a banana or an avocado. Avocado costs are certainly going to go up. So it's going to be tough, right? If I go to Chipotle and everything at Chipotle is more than it costs at McDonald's, I might end up at McDonald's more than Chipotle. I don't know. So we're talking about all this health, and then jobs are being lost, and all these things. And again, this is a reality. And there was problems under the last administration with jobs and stuff, and then there was a pandemic, and before, and this is not a political statement. This is a reality statement. And we, as the healthcare professionals in whatever the climate is, have to be ready to face whatever the reality is. What do you all think about what we can do as a community right now that are about to face a reality where jobs may be lost, prices are going up, healthy food choices, the price of healthy foods are going up? What are we gonna do? I don't know. Anybody, any thoughts? What are we gonna do? What can we do? How do we help our families? How do we become better community? Any thoughts, anybody?
I think we're starting it by doing just this.
Okay, wonderful.
Talking about it, addressing it,
Yes.
and then we can start making those solutions.
I love that. I love that.
So.
I love that.
I love that. And things like the master experience
I thought
weekend
that too,
and
yes.
the health and vendor fairs. And
Yes.
you guys are right. I'm not on the panel. I'm just, I don't know.
Yes, yes.
But I'm just saying,
Yes.
I think, the conversations about these things and what we're talking about, and then if we just continue to have these conversations in the community and be accessible to have these types of conversations with people, because sometimes we can seem a little shut off. I can't deal with you right now. And I try to lean more into people that are coming up and just, you can't give everybody time. But if there's somebody that comes up to you, just being accessible and being able, just allowing yourself to just give some resources or talk to them, especially at this vendor fair. There's going to be so many people that are going to be there with questions. Just being accessible and you guys are all already here on the panel doing this on the live, so you're already in one step, in the great direction of being accessible for, to our community. And when we talk about community and health, what is one thing in our community, in Stark County, that we might just not utilize enough when it comes to bettering our health?
You literally stole the question.
I'm
I was
sorry.
looking at.
I
I
love
love
that.
it. High five over Lucas.
High five through me.
High five over
Yes,
Lucas.
yes.
Go ahead.
Love that.
So I think our faith-based community is a hidden powerhouse. We do not leverage our faith-based community enough. Our pastors, our bishops, they are the unofficial leaders of community. And I think that a lot of the messaging that we need to get out, we need to be in collaboration with our churches, because they have a level of influence that I will never have. So if we collaborate with them and talk about these things and have them push these messages out in the churches, in those spaces, then I think that we would have a bit more success. I think about during COVID time, and we had this vaccination hesitancy. We leveraged our churches, and we were able to vaccinate. Okay, I'm gonna say this disclaimer, like whether you get vaccinated or not, I'm not judging, I'm just, So we were able to vaccinate far more people because my pastor Sherman Martin said, I got it. This is okay, right? So let's leverage our faith-based community. We have to start having diabetic education groups in our churches.
Yes.
Having screenings in our churches, because knowing our numbers is huge. We don't know our numbers, so let's screen in the churches. Let's leverage that. Let's get back to the roots of the power of our communities.
And I think
Love
just
that.
to piggyback on what Latrice said was mental health. A lot of our pastors in our faith-based community are dealing with so many mental health and addiction issues.
Yes.
And we at NAMI Stark County offer education programs at no cost. So we have a program called FaithNet that we can bring into the faith-based communities.
I didn't know that.
We have Sharing Hope, which we can bring to the communities of color. Our website, namistarkcounty.org, we have a lot of resources, and I'm looking at Molly here from our team. But we offer a lot of education programs at no cost. We offer support groups. We do advocacy. So if someone needs help going to an inpatient or outpatient team meeting or court or something like that, I saw one of the questions is, what is a hidden resource in the county? And I always say we're the best kept secret in town because we're small but we're mighty. But again, how can we help? And I'm skipping ahead on the questions for employers. How many of you, there's 15 of us in this room, how many of you know that the leading cause of missed work is major depression?
I did not know that.
Which leads to the leading cause of lower production. If we take the 15 people in this room and 1 in 4 is impacted by mental health, either themselves or a family member or loved one, we can count off here in the room. So again, how can we connect? How can we educate? And I think one thing that Stark County is really progressive is trying to get out of our silos. Well, Altman does this and Mercy does that, and health. the community collaborations and partnerships, strong family wellness. You know, it takes a village.
Yes.
It does.
It really takes a village to take care of our folks, whether it's physical health, mental health, or addiction, because, as was said earlier, it's a family disease. And we say mental illness isn't a casserole disease because when our loved ones are in the hospital or jail, which is the largest mental health provider in our county, is the Stark County Jail.
Wow.
She's absolutely right.
Interesting.
Nobody brings us casseroles. Nobody sends cards. Nobody calls because it's so taboo.
Yeah.
You know, so the village mentality, and if this group can continue this effort, there's no stopping the people in this room.
Yeah, and I need to put a shameless plug out there to both of your points. The Canton City Public Health supports a coalition called HOPE, which stands for Health Overdose Prevention and Education, and it's fully driven by Mount Zion Community Development Corporation, which is led by Pastor Michael Presley. And we have a strong relationship with a lot of our pastors, specifically in the Black community, because the overdose rates are so high. And so that coalition is community driven. They wrote the strategic plan. They're addressing the strategies. They're addressing kind of responsible for getting the word out there. And we just secured additional funding for that for them. And so I think the pastor route and the faith-based community is so important, and just kind of an example of what we're able to do in the community. And if anybody's interested, reach out to Pastor Presley through Mount Zion. It's a wonderful community group. Many pastors are on that coalition. Hopefully we can start seeing some real change.
That's awesome.
And I'm so glad that you put that there. I just want to say, and I want to make sure that we don't forget that each month holds something special, right? And April is Minority Health Month. This whole conversation that we're having today with two different groups of types of health experts is all funded by the Ohio Commission on Minority Health. Because April is Minority Health Month, and it is time for us and our communities, to Kay's point, to get out of our silos, to collaborate, and to really become that stronger, what did you say, community is the antidote to addiction, that we become a stronger unit in doing that, because that is how we really become well. You know, with our mission with Strong Family Wellness, we want to see families, no matter whether the nucleus is, you know, standard, non-standard, whether it looks the same, it all looks different, it doesn't matter who your family is in that incubator. We want to make sure that that's as strong as it can be. Physically as strong as it can be, mentally as strong as it can be, and then spiritually as strong as you can be, whatever your faith is, because I think sometimes we tend to shy away from knowing that what you believe in plays a huge role in how you live your life. It doesn't matter whether it actually is a faith-based notion or a life-based notion. What you believe in plays a huge role in that. And so this conversation alone is really building that community for what we believe in and how we can really be active and involved in changing what we're seeing in our communities this month.
Absolutely.
And our community is, we are resource rich and connectivity poor. Stark County has more resources than any community that I'm aware of, but we don't connect. Folks don't know that the resources are here for them, but they're here. We have to do a better job of connecting with these, and this is the way that we do it, bringing all of us together so we can then talk about things. And then my challenge is ask someone out for coffee so that you can learn more, so that you can go into your circle of influence and you can share it, because people are dying because they don't know there's resources that could be a lifeline.
Absolutely. So as we wrap up this conversation, I want to kind of end with, you know, this community. And I want to kind of go back to Mr. Presley from Mount Zion. So I went to, I forget what event it was, but he taught me how to use
Torrey Fonce's.
Torrey Fonce's
back to school giveaway.
Oh, yeah.
And
Southeast Community Center.
Mr. Presley taught us how to use
Narcan.
the
Narcan.
Narcan. And it was really quick. It was probably like a 5 or 10 minute, like he showed me really quickly. How I signed my paper and it's in my trunk. And now if I ever see anybody, I can hop out the car.
You're like a
and help.
superhero.
I am. I got a cape.
Yeah,
too.
I like that. He gave you a cape and
But
some
when we're talking about community and
Dandy.
people, right? I've always been a big community advocate. I love my community. This is where I'm from, so it's just, it's my heart. I've been in all types of community programs when I was a kid, so I just give back in that way. So when he had asked us, I said, heck yeah, I'll do that. I'll be the next girl on the street to help somebody out. So we're thinking about community, and we're thinking about ways that we can be involved and advocate and just be involved in any way. When it comes to like volunteering for any programs, I don't know if NAMI, if you guys support volunteers, if you guys know of any resources or anything for anybody out there. We have our audience that are watching, our viewers. We love you guys. Thank you so much for sticking around for this conversation. If anybody out there is not in the medical field, they're not a medical professional, but they just want to help. They just want to be a part of the team, the community, to help and advocate and bring awareness to these things. Are there other programs out there that
or in your program,
or your program, anything that you guys offer?
Listen, shameless plug time.
Okay.
No shame.
Full shame.
Plug.
Charitable pharmacy. I'm not sure if everyone knows what Beacon does, but Beacon is boarded by the Ohio Board of Pharmacy. We are just like your Walgreens or your CVS, except we don't bill insurance. We provide medication to people free or for $2, $4, or $5. Our medication is donated to us through something called the Ohio Drug Repository. So it comes to us in bags and boxes, and we have to sort it by alphabet, by prescription, by strength, by expiration date. We don't give out anything expired. Without volunteers, we could not get this medication back on the shelves to get it into the community. So if you have in your heart to volunteer, please call me at Beacon, because that is life-changing and anyone can do it. If you can count, if you know the out, heck, if you don't, I can give you right, you can black out for information.
Right.
But we always need volunteers. We could not push forth our mission without volunteers.
That's amazing.
Thank you.
And I would add, so naloxone or Narcan that you talked about, it's very important that the community responds, because with an overdose crisis, you can't Narcan yourself. And so we need helpers. We need people who are like, that person needs help and they're willing to respond. So at Canton City Public Health, we do have a mail order program where you can actually just go on our website and request a kit. You do a really quick training and then we'll mail it out to you. We also have a program that's also starting back up with Canton Fire. It's called Save a Life Saturdays, where you can sign up and go to Canton Fire on 25th Street and do CPR classes, community hands-only CPR, stop the bleed, and also overdose response training. It's all done in the morning, and you're done by the afternoon, and then you're equipped to save a life and respond in the community. So things like that. And then from volunteering, I think it's really important. I hear this a lot in the community, especially with the youth or young people, maybe not youth, but maybe 18 and over, being involved and getting involved in boards. Getting involved and finding an organization whose mission you can stand behind and that you want to help advance. They're always looking for that perspective of someone who's younger, honestly, and a little bit maybe more innovative than some of us who have been doing the work for a long time. So it's a way to give back there also.
That's good.
Yeah, and I would echo, we are looking for additional board members to fill our
There
board.
you go. Look,
This is
Perfect.
great.
I have some
that.
ideas sitting around this panel today.
All
So
right.
many great people in the room.
But we also, we are a small staff. We're small but mighty on our paid staff. But our programs are facilitated by trained volunteers, whether that's an education program, whether that's a support group. And then we have two major fundraisers each year. We have our annual golf outing and our annual NAMI walks. And we couldn't do those events without our volunteers. So we have lots of opportunities. If you don't want to teach a class, you don't want to run a support group, do you want to come in the office? Mom, looking at Molly, she needs some data input. If you love spreadsheets, so we can kind of tailor things. And all that information is on our website under volunteers, and it actually has descriptions of all of our positions that we have available.
And I just two more things really quickly. United Way has a hub where you can go on and look for volunteer options. So if somebody's interested in volunteering in the community. And then the other thing too is volunteering and being involved socially is actually good for your health. And so social context is considered a social determinant of health. When you don't have that, it affects your health negatively. So if somebody's looking to improve their health status, getting involved is a great way to make a small step towards better health.
I love that point. That is great. That is great.
And I just want to add that we offer a program called Peer-to-Peer. And we have offered this education programs. And we've had folks that haven't worked for years decide to be a leader for the program. We've seen folks go back to work, go back to school, and we have several couples that have met in our peer-to-peer class.
There's dating, love connection. We also do the love connection over there.
I need to come back.
That was a nice plug. She's like, we also do the love connection. Right? In case you're looking for that. Wonderful. All right, one more thing we want to do is we want to shout out your sponsors. You have sponsors that are helping you pull off this wonderful wellness fair. We want to throw them up on the screen, and we want you to shout out your wonderful sponsors who've made this possible.
How cool is this? Every year we get a chance to do this, and every year we get to collaborate with so many different organizations. So we just want to say thank you to all of our partners. NAMI, Stark County, we definitely want to thank Canton City Public Health and Beacon Charitable Pharmacy. Everyone you see here today, their organizations have decided that for them to be a part, but also that this is a mission that they want to see the city healthier. So Chick-fil-A in Richmond, the Bisbee Group, Mark Bisbee will be the honorary chair this year for the NAMI Walk as well. We want to thank our local community action agencies, Delta Sigma Theta, Omega Sci-Fi as well, Sam's Club, Employers Health. Thank you so much to Visit Canton as well, and SARTA and Altman, Seacrisp and Checkpoint, First Commonwealth, you name it. Beacon and Equity House, we are so appreciative of all of the support that we get in making this happen, just so that people can have the resources, so that we can never let resource be an obstacle. So
Awesome.
thank you, and thank you guys too. Thank you, Lucas Live Media, for allowing us to do this. We appreciate it.
Our pleasure, absolutely.
Thank you guys for coming on. This was a great conversation. I'm not gonna lie, I was a little nervous when I came in here, but you guys, you guys did a great job. This conversation was so needed, and I think I'm just grateful that we are able to have this platform to be able to do things like this, to connect with our community, and have people like you guys come in and represent for your organizations in our community, advocate for our community. So thank you so much. Thank you. So right now we are going to shoot it over to our sports segment. You're going to see a new face. You're going to see Miss Tiffany on the screen. So this is Tiff with the Lucas Live News sports segment. We'll see you guys real quick.
What's up, sports fans? Welcome back to another action-packed edition of Lucas Live Sports with your host, Tiff. We got some major headlines, huge accomplishments, and exciting opportunities to share with you today, so let's get right into it. We're kicking things off with a huge congratulations to Darren Peterson, who has been named the 2025 McDonald's All-American Most Valuable Player. His hard work, skill, and dedication continues to put him on top, and we can't wait to see what's next. Keep doing your thing, Darren. The McKinley girls flag football team is officially here. Their spring season schedule is out, and we can't wait to see them compete. This team is bringing the energy, the plays, and the wins, so make sure you guys are out there to support those Bulldogs this season. The McKinley Bulldog baseball team had an impressive week, securing back-to-back victories over Perry in their Federal League Series. This past Tuesday, they clinched a 6-5 win at home, and Wednesday, they dominated with a 14-6 victory on the road. These wins boost the Bulldogs to a 3-1 overall record and a 2-0 start in the conference play. Keep swinging for those fences, Bulldogs. And the wins keep coming for McKinley. A huge shout out to the Canton McKinley Band, who just won the 2025 OIPA Percussions Concert Class A Championship. Their dedication and passion for their craft continues to set them apart. Big congratulations to those talented musicians. The Bulldog basketball squad has some stars getting well-earned recognition. First up, we have Reed Sims Jr., who has been selected a third team All-Ohio Division I, while Anthony Chavers has achieved honorable mention All-Ohio Division I. These guys have been putting in some serious work all season long, and their efforts are paying off in a big way. Congratulations to both you and the entire McKinley basketball team. Hey parents, it's time to get those kids signed up for some amazing sports camps. And here's what we have for you coming up. First up, we have McKinley Youth Basketball Skills Camp, which this is going to be March 31st through May 7th at the Bulldog Activity Center, and this is open for non-residents, so make sure you get those kids out there. And we also have the Canton Baseball Dirt Dog T-Ball, and the registration is by April 25th, so make sure you get those kids signed up. Well, that's a wrap for today's sports segment. A huge shout out to all the athletes, teams, and coaches putting in all the work to make the moves happen. Whether you're on the field or even behind the drum line, success doesn't happen by accident, and you are all showing what dedication looks like. Thanks for tuning in, and we'll see you next time with Lucas Live Sports. Keep grinding, keep competing, and as always, stay locked in for some more sports action.
Well, that was a great conversation,
Yeah,
and
it
we
was
are
amazing.
so excited. Shahidra, thank you so
You're
much.
welcome. Thank you guys
This
for
was
letting
great.
us
You
be
did a
here.
great job, too.
Thank you.
Wonderful job. Thank you so
tried.
much.
I
Thank you,
tried.
everybody out there that watched, that stayed tuned. We had a
Yes.
great time seeing you guys in the comments, engaging and getting something out of this. I think that's the major part, is you guys getting and receiving something
Yeah.
from this. So thank you guys so much for tuning in. Shahidra, thank you. Lucas,
Yes.
great
Yes, thank
job
you
to
guys.
you
To
too.
all of our wonderful guests,
Yes.
you guys make
Yes.
sure you check them
Thank you
out.
so much.
We'll make sure they jump into the comments later and put their names
Yeah,
in
put
there
their
so you
names
guys
in there, their
can
organization.
make sure you guys connect with them. And today was just a wonderful day.
Yeah.
April 12th, 10 a.m. to 2 p.m.
10 a.m. to
at
2.
the Canton Civic Center,
Yeah.
the Strong Family Wellness.
4th Annual Community Health and Wellness Fair.
Love
We'll
it.
be out there.
We'll see you guys
See
there.
you guys next time.
Bye. Thank you guys.
Have a great day, everybody.